decided at a very young age to become a clinical psychologist because of the devastating lack of mental health facilities and support for the mentally ill in the Central Valley. The Central Valley has the highest amount of mental illnesses in California, with the lowest amount of health professionals. In fact, 5.1 of Fresno residents have been diagnosed with a mental illness. However, there are only 12 psychologists per 100,000 people. And with a whopping poverty rate of 27.1%, how are Central Valley's residents expected to pay for the help that they deserve? Today, I'm going to discuss the issues that the Central Valley has faced and is currently being presented with regarding mental health care. We'll begin by reviewing the current mental health care and resources that are available to Central Valley residents today. The biggest mental health facility available right now is at Community Medical Center. It's called the Community Behavioral Health Center. It's a 61-bed acute psychiatric hospital, and it's a 24-hour adult inpatient care. And so there, the Community Medical Center provides psychiatric assessments, forensic services, which are basically custody services. They provide recreation therapy, group therapy, individual therapy, medication management, and a few other therapy sessions as well, or therapy types as well. There are also free resources and counseling services available for every student that is enrolled in public school in Fresno County. And also at Fresno City College, we do have a psychological services in the student services building. All you have to do is schedule an appointment with a psychologist there and you'll get free counseling. As well as all of those free resources available to the people enrolled in public school. There are also several private practices for psychologists and psychiatrists in the Central Valley, and some do take insurance. But with a poverty rate of 27.1%, most people who don't have insurance can't even afford one session of therapy. On average, Americans pay anywhere between $20 to $250 per hour per therapy session. And talking about that, what about the homeless? If they can't afford basic needs such as food, water, clothing, a house, a car, how are they expected to get mental health care that they deserve and they need? And now that we've discussed the current available resources for the mentally ill in Central Valley, let's look at why there might be an alarming rate of mentally ill residents in the Central Valley. It's been suggested that there's a link between poverty and mental illness in the Central Valley, and it's also been suggested that San Joaquin Valley, a shortage of mental health professionals is a huge challenge for its residents. And since the poverty rate is so high in the Central Valley, which I mentioned earlier, it's 27.1%. Most people who live in the Central Valley either go to the military, that way they can get the benefits of the GI Bill, or unfortunately they turn to drugs to cope with their mental illnesses, such as depression or anxiety from having to grow up in poverty. In 2017 alone, 158 Valley residents died from opioid overdose, and a whopping 232 Valley residents overdosed on amphetamines. Addiction to opioids and amphetamines causes damage to the dopamine receptors in your brain, and too much dopamine in your system and in your brain causes other mental illnesses like psychosis and schizophrenia, which doesn't help the Central Valley's case at all. Mental illness stemming from early childhood stress from living in poverty is also heavily linked to the Central Valley. And with mentioning that, I'm sure that you can see how scary this world is without mental health care. There are so many homeless people and drug addicts on the streets every day, all because they were unable to get the help that they deserve and that they need. And I'm sure that now that I've been talking about this, you can start to see how devastating lack of mental health care can affect families. If you try to put yourself in a family member's shoe, in the shoes of a family member of a mentally ill loved one who watches their best friend lose themselves in a battle with their mind every single day, and if you're not able to help them because there's not enough resources, or you don't have enough money to help them, can you imagine how devastated you and your family would be? Mental health is important and it's real. Mental health doesn't discriminate, and it can affect anyone at any time. It's so important to have the resources to ourselves, for our loved ones, and the people in our community to get better and get the help that they deserve. We can all do something to break this cycle of the mentally ill not getting help, and we together need to break the stigma of mental health. It would be extremely helpful for the Central Valley to have a number of free walk-in mental health clinics all over the Central Valley, not just in Fresno. It would also be very valuable to have mandatory therapy sessions for children in public schools. That way they have resources to go in and talk to someone every single day to talk about what they might be going through, what their families might be going through, or anything like that. Because if going to therapy was more normalized during childhood for everyone, I believe it would be effective in breaking the stigma that mental health isn't real or it's embarrassing to get help. Because as most of you can imagine, if you're seen going to the psychologist's office at school as a high schooler or a middle schooler, can you imagine how ruthless those kids would be? Can you imagine how much those kids would be bullied if they would go to the psychologist's office and kids would see that? So I think that if maybe that there was a period, like a mandatory period during school for every single kid to go and meet with a psychologist every day, I think it would be very helpful for psychological help to be normalized. Something that we all can do as educated college students is go and speak to faculty at primary schools about the importance of therapy with students. And we can also start and sign petitions to help get more fully funded mental health centers all over the Central Valley, and hopefully all over California as well. The Central Valley has an alarming rate and an alarming issue of mental illness, drug addiction, and poverty. And it's up to us as a community to help our residents get better and to help provide more mental health resources in the Central Valley. So today we have reviewed the current mental health resources that are available for the Central Valley and its residents. And we have also reviewed why there is so many Central Valley residents who have mental illness. I hope you now have an understanding of why most residents are unable to seek professional help to get the help that they need. And I also hope that you understand the importance of going out in the community and advocating to get more mental health resources for the mentally ill in the Central Valley.